welcome to a special session with Aveya Natural IVF and Fertility Center. I'm Simran Kaur, your host from My Healthcare Buddy. Today, we have the privilege of delving into the crucial but often overlooked aspects of reproductive health with our distinguished expert. Joining us is Dr. Nisha Bhatnagar, the Medical Director and Senior IVF Consultant at Aveya Natural IVF. We welcome you, Doctor. Dr. Bhatnagar is not only a renowned expert in fertility solutions, but also a guiding force in understanding the intricate correlation between diabetes and fertility. We'll be exploring a spectrum of topics from the evolution of IVF to lifestyle influences on fertility, and also we'll be unraveling the mysteries surrounding diabetes and its impact on reproductive health. So, welcome, Dr. Bhatnagar, and thank you for joining us today.
Thank you. Thank you, Simran. Thank you, first of all, for giving me this opportunity. And I think that you are doing a great job by spreading awareness for a topic which is often overlooked. People do not care about their health as much as they even care about their phone or something. So I think you are doing a great job spreading the awareness. Please go ahead.
Thank you, Doctor. Thank you for joining us. So, to start with, if you could maybe just talk about the evolving landscape of IVF and how you've seen it transform over the years.
Okay. So I'll tell you, the first baby was born way back in 70s, and that was a natural cycle IVF. Natural cycle IVF means there was one egg forming at that point of time, and they retrieved that one egg laparoscopically. So the major breakthrough came in IVF when we started doing the pickups transvaginally with the help of an ultrasound. Initial pickups were done with laparoscopy. You had to put the laparoscope in the abdominal cavity and try to catch the egg. That was a very complicated maneuver, and all the more it was difficult for the patient also. So the first breakthrough came when we started doing the pickups, the retrieval of the eggs with the help of a transvaginal ultrasound. Now the second was when we modified the event of gonadotrophins, when the hormones were the hormones were separated from the menopausal female's urine, and they were collected, and those were used for injecting the females to form multiple eggs in place of one egg. The gonadotrophins were the second thing. Third breakthrough came in form terms of ICSI, when earlier mostly the indications for infertility were tubal factors or female reasons. But with slowly over the period of time, we saw that a lot of percentage, around 30 to 40% of males also have low count and motility, and some of them have very very low count. Even after retrieval of sperms from the testes, we could not use them because they were not good enough for doing IVF. So the third was ICSI, when we used the intracytoplasmic sperm injection to fertilize the egg. And after that, the major breakthrough was in vitrification, when we modified the techniques to freeze the embryos. And now we can even freeze the ovarian tissue, ovarian cortex, and egg freezing is the latest thing. In future we are looking at artificial intelligence. It has to play a lot of role in IVF and ICSI. So AI is the next big thing.
All right, thank you, Doctor. Moving on, you, as we all know, you're a seasoned expert in fertility solutions. So, what motivated you to specialize in IVF, and any developments that you might have witnessed?
So I don't know. To begin with, the endocrinology was something which I was fascinated by that. The interplay of hormones. I used to call that dance of hormones. So when one decreases, the other one increases, and I was very fascinated by how the brain is able to control that, and how a simple change in the thought process or the simple change in activity can influence the hormones a lot. So that was one thing. And then I used to see the couples, the societal pressure, the stress they have for getting pregnant, and if they are not able to get pregnant, any other form of disease does not contain that much of social stigma as infertility. Because what happens with infertility is that you are absolutely healthy, you are absolutely normal, and people fail to recognize that there is something wrong with them. It is, totally not acceptable that मैं तो पूरा healthy हूँ, everything is fine with me, मैं अच्छा खासा खा पी रहा हूँ, भाग दौड़ कर रहा हूँ, फिर मेरे sperms क्यों नहीं बन रहे. Very, very difficult part for the males to accept that they are infertile. And then the females, the societal thing, the pressure, all that sort of motivated me to bring happiness into a couple's life by the way of infertility treatment. And that's how I started my journey into infertility. And trust me, it is sometimes, it is very it's very distressing in the sense that you don't have answers. Each human being is different, सबकी body अलग है, same medicine, same dose, डिफरेंट डिफरेंट लोगों में डिफरेंट रिस्पॉन्स देती है. सो यू डोंट हैव अ कॉमन पॉइंट कि आपने इतना डोज दिया और ये रिस्पॉन्स आएगा. सो देर आर थिंग्स विच आर डिफरेंट, there are things which are distressing. Sometimes you feel that there is no cure, no control. But then, even one patient, when brings the baby, the smile they have on their face, that's the most motivating thing.
Right. You spoke about the stigma that is there around infertility. Any other misconceptions or myths that you would want to highlight around, infertility, or maybe around IVF that you would want to talk about?
सबसे पहला तो द मिथ अराउंड आईवीएफ इज दैट पीपल फील दैट आईवीएफ कराया है तो कुछ आर्टिफिशियल कराया है. इट्स नॉट नॉर्मल, इट्स नॉट नेचुरल. लेट मी टेल यू वन थिंग, इट्स एज नेचुरल एज पॉसिबल. ओनली थिंग इज दैट दिस फर्टिलाइजेशन इज टेकिंग प्लेस outside the body and not inside the body. Rest all phenomena is egg and sperm taking care of it themselves. Okay, only thing is that if it is happening inside the body, you call it natural conception. We do it in the lab, so it is IVF. So इसमें कुछ भी ऐसा abnormal नहीं है. दूसरा myth लोगों का होता है कि ये बहुत painful process है. Natural cycle IVF, not at all painful. We are not injecting you with hormones. We are not giving high dose of medications. We are trying to get that one egg which your body is producing, form my embryo and putting it back inside the body. Then the third thing people have is that कि अगर मेरे, if my, most of the people ask me this question कि if my eggs are taken out, will there be nothing left? No, it's not like that. The eggs are coming in form of waves every month. On the second day of the period, every female has around 5 6 eggs in both the ovaries, and out of that we only one grows. When we do IVF, we give some medicine injection so that all of them grow. So we are targeting the eggs which are there only in that cycle. We are not taking the eggs from the back or from the, the from the reserve. So it does not deplete your reserve. It is not a painful process. Another misconception people have is that कि IVF कराया तो bed rest करना पड़ेगा, बहुत ज्यादा बेड रेस्ट करना पड़ेगा. नो, दैट इज अगेन नॉट ट्रू. यू डोंट नीड टू बी ऑन द बेड. रादर वी से दैट the reason why infertility is increasing so much is because sedentary lifestyle is there. People are not moving at all. People are not doing physical activity. So if you are physically active, if you are doing your normal activity, it does not affect the outcome of IVF. You can be as normal as possible. The last but not the least people have is that you can find out male or female from this. No, that is also not possible. The sperms are all same. We cannot make out whether it's a male baby or female baby. The sex is assigned to the baby at around 8 to 10 weeks of gestation. So before that, we don't know whether this embryo is a male or a female. Only genetic testing can be done to find out, and that is banned in India. So there is no way to find do this kind of thing and have a any discrepancy in the outcome. And then there are a lot of things like physical activity nahi karna hai. So I believe that each case is different, each patient is different, and individualization is the key to success of treatment. So कोई standard protocol के साथ मत जाइए. वो डॉक्टर जो आपको आपके लिए बेहतर बताए, go with that.
Right. So, doctor, also there would be some emotional aspects of IVF. So, how do you support and guide couples when it comes to psychological challenges that might come up?
So, not some. Actually, a bigger part of infertility is this emotional burden, this psychological burden. So, there are people whom we have seen that there was nothing wrong with them. There was this couple who came to us, absolutely beautiful female, and husband is also good, and just because they started their life normally, but over the period of time family was pressurizing for having a child, and this pressure reached to an extent कि now they were not able to have intercourse, बिकॉज जब भी वो नॉर्मली कांटेक्ट करने की कोशिश करते थे वही थॉट प्रोसेस, वही फेलियर और वो सब कुछ दिमाग में आता था. तो दिस साइकोलॉजिकल एंड सोशल एंड इमोशनल बर्डन is a huge one in infertile patients, and that needs to be treated before we move on any treatment. So we have three ways to deal with it. Number one, we do a lot of psychological counseling. We explain the whole procedure to the patient. We make them understand that it is not your fault. Infertility is nowadays a pandemic, it is all over the world. It's not because you did something wrong, that's why it is happening. Another thing which I'll tell you, which is I think strange to India, is that people think that infertility is a curse. मतलब ज्यादातर लोग जो हमारे पास आते हैं वो सास और वो सब फैमिलीज आती हैं. सो कई हद पे कई बार जो माँ वगैरह होती हैं वो ये कहते हैं पता नहीं इसने क्या कर्म किए थे कि इसको ऐसा हो रहा है. That this is some a very wrong statement. We need to understand that this is a disease, this is a problem which the victim, the one who's suffering from it, is a victim. It's not her fault, she did not do something to bring it on her. It's not her problem. It's just that it is a disease and she's suffering from it, and she needs to get a treatment for it. So, still, we have to go a long way, but I think education and awareness is a big thing in that. And people who are someone like you who's trying to spread awareness is a huge step which needs to be applauded.
Yes, doctor. So, apart from the
Okay,
testing bit
sorry,
and
I,
everything that
I
we.
sorry, I forgot your question. Your question was how we address that. So we all know that this
Yes.
burden is there, but then the addressing. So we have a
Mhm.
counselor in clinic, in-house counselor is there, and then we ourselves do the counseling. We explain them the whole procedure. We try to focus on the problem, on the disease, not on the the not to blame on each other, not to put the blame on either the husband or the wife. Usually we tell them that it's the combination which is not working, it's not your problem. So counseling plays a very important role. Then we have various sort of scoring system which tells you that what is the stress level of the patient, how what is the level where she is experiencing the stress. So we ask the patient to fulfill those forms which tells us that how stressed she is or he is, and then we take the steps accordingly. And third thing is that at each every step we provide them with the information that what is this, how much percentage of people is suffering from this, what is the incidence of this, or what is the treatment for this. So we try to focus on the problem and solution rather than the melodrama around it. And I think it gets sorted with a proper counseling, with proper scoring system. Sometimes if we need, we take the help of psychiatrist also, we take the help of functional medicine people, and we take the help of lifestyle modifications with the help of dietitians and all, and that helps a long way.
So, one thing that caught my attention, ma'am, you mentioned that it is the problem of the couple, not an individual. So, any specific gender that you feel is being blamed for this more often?
Yes, the females are all the time. It is considered a female problem. Abhi to fir bhi there is awareness that people are realizing that male could be a cause of infertility. But earlier, though, I will tell you one case where I had this couple, and it was his third marriage. So two wives he divorced, thinking that they are not able to produce children. And the third time, when the third one also was not able to produce the children, and surprisingly, the first one had a baby with another marriage. At that point of time, the male had this realization, okay, fine, something might be wrong with me. And then they came for treatment, and we come to know that the male has no sperm. It is azoospermia. So this burden of infertility is more on the females because this is considered to be their problem. It is considered to be, the root of the problem lies with the female. So males are not able, not only they are able to come for treatment, they are also very difficult to accept that there is something wrong with them. They take it very personally. उनका बहुत ईगो हर्ट हो जाता है अगर कहो कि मेल का इनफर्टिलिटी है या उसकी वजह से या स्पर्म नहीं है. So they take it very badly. So females are being more blamed by in-laws and everyone that they are the cause of infertility. Though that is not true. It is a equal responsibility.
Right, yes. So, to expand our knowledge further, any of the lifestyle factors or the overall health, health considerations might lead to the success of IVF treatment that you might want to shed some light on.
Yeah. So before moving on to success, I would like put light on causes of infertility. So the lifestyle, what you said, I believe that that is the most important cause of infertility. Leave apart certain cases where female had tuberculosis or some pelvic infection or the tubes are blocked or some congenital malformations are there or male has some problem, undescended testes or something. The major chunk of patients coming to us, infertile patients, is lifestyle disorders. All of them are suffering from hypothyroidism. Almost 99% are females are suffering from hypothyroidism, and almost all of them are a little overweight or obese. They have sugar, insulin. They have insulin disorders, insulin resistance, and they are going towards diabetes or something. So all of them have lifestyle disorders, physical inactivity, late marriages, um, trying for having children rather later part of the life. All these things contribute to this. Too much of food availability, too much of eating out, eating junk, too much of smoking, drinking, abuse of drugs. All these factors are major responsible factors for contributing to infertility. So that needs to be corrected. Diabetes is a huge problem in our country nowadays. Almost all adolescents, even we see that they are obese, they have insulin resistance, and they have that बिल्कुल ही चेहरा देख के पता चल जाता है. एक डिसइंटरेस्टेड सा बच्चा अपने मतलब एक कोने में बैठा हुआ है, फोन लेकर के बस उसी को करे जा रहा है, लिटिल बिट और लिटिल ओबीज और हेवी वेट. So these things start right from the adolescent age, and if we correct it there, I believe that the burden would not be there so much on the society of infertility.
So, ma'am, you appropriately spoke about diabetes, but another cause of concern that I feel that I am also suffering through is PCOD. Anything that you would want to, specifically talk about that condition, how it can be controlled to
So
prevent
PCOD
infertility in the first
PCOD is maybe you can say that PCOD and later diabetes, they are linked. The reason for both is insulin resistance, and either it can be in the genetics or the major problem is lifestyle. So if you analyze, I don't want to individualize it, but most of the females, if they analyze their lifestyle, they will see that they are spending more times on the chair. They are sedentary lifestyle. They are not physically active. They are not eating as per the body requirement. Most of the eatings are in the late nights. Some sort of munching is going on throughout the day, and the food habits have changed. Instead of eating a proper healthy diet, we are taking sometimes kabhi aise momos kha liya, kabhi pizza kha liya, kabhi burger kha liya. So proper diet nahi mil raha hai, proper exercise nahi ho raha hai. Genetically we are tricked into having all those genes which are related to all these disorders because of again inactivity and all. So this is the prime reason. PCOD is, I would say, a little early stage of frank diabetes. Most of the PCOD females, if it continues the same way, end up having diabetes, hypothyroidism, hypertension, the triad. Okay, and then they have further problems. So I would suggest that the first thing we need to do is create awareness about this. Start doing walk, yoga, exercise, eat properly, balanced meals with a breakfast, with a mid meal, proper protein and everything, and an early dinner. The key is having around dinner by 7 7:30 and keeping at least a 14 15 hours of fasting window. Okay, लोग क्या करते हैं, रात को 2 बजे तक खाते हैं, फिर उसके बाद अगले दिन 4 बजे तक फास्टिंग विंडो रखते हैं. दैट इज रॉन्ग. दिस इज रॉन्ग. So you need to go by the sun cycle. The one that when the sun sets, your eating should be stopped. When the sun rises, next when the full fledged morning is there, then you start your day with a proper breakfast, not something, some munchings or anything. Okay. So diabetes
Right.
has a huge role in that, and insulin resistance is the key factor to that. सो बेसिकली कहीं पे भी जहाँ हमारे फैट सेल्स ज़्यादा हो जाते हैं, एक कॉम्प्लेक्स हार्मोनल डिस्प्ले इंटरप्ले होता है, और उसको करेक्ट करने के लिए, उसको ब्रेक करने का एक ही तरीका है, यू स्टार्ट डूइंग वॉक, योगा, एक्सरसाइज. वॉक एटलीस्ट 45 minutes. Yoga means calming down, meditation, thinking about, like, just sitting down and breathing for at least half an hour, and exercise like some aerobics or simple walking or jogging or simple Surya Namaskar. All these things help you in getting overcome this problem of PCOD as well.
Right. Thank you so much for your insights, Doctor. So, bringing it all together, any advice that you would want to give to individuals or couples considering IVF, and any message for creating awareness for them?
So, my first message and my first request to everyone is to start working on a healthy lifestyle. Start doing some sort of incorporating some sort of physical activity in your daily day to day routine. Then try to eat healthy and try to avoid food, especially after 7:30 p.m. Then my another request would be, if you are considering IVF for some reason, do your research first. Try to see if the lab, there has to be a proper lab, there has to be a trained embryologist. Try to talk to the doctor what plan the doctor is suggesting to you. What is she planning? What is the doctor planning? What kind of medication they are going to give you? What kind of injection? What dose of injection? Have a complete report with you. Take all your previous papers to anyone who are getting treatment with. Okay. And then just try to improve your lifestyle, because if there is a healthy egg, if there is a healthy sperm, there is a higher chances of having a healthy embryo and a live baby. If the egg is not healthy, if the sperm is not healthy, even if you go for IVF, it's going to have the same egg and the same sperm. Only thing, it is happening inside the lab. And the chances of resulting in a bad embryo and miscarriage would be higher. So correct your lifestyle first, correct your health status first, and then you can work towards success.
Thank you, Doctor. As we conclude this insightful session with Dr. Bhatnagar, I want to express our gratitude for her expertise and valuable insights. I'm Simran Kaur signing off, and we'll be back with some more engaging conversations on health, wellness, and the latest advancements in medical science. Thank you so much for joining.
Thank you. Thank you, Simran. Thank you so much for giving me this
Thank,
opportunity.
thank you.